Now I'm going to know her by Ammukutti.
Amulya.
Hi, this is Dr. Nishi from Naadi Yoga. And I know it's been a long break of 1 month because I've been away and I'm back. And we have Amulya over here. And they are from Andhra Pradesh, or would you call Bangalore?
Andhra Pradesh.
Bangalore in middle.
Yes.
Yeah. So Amulya is around 3, right?
Yes, ma'am.
So when you came to us recently, you told me about the history of her seizures and everything else. Would you want to share your story about what happened and about the B12 and everything? How it's very important to get those blood tests done and things like that.
Hi, this is Vinod, Amulya's father, and Pratibha, Amulya's mother. So she was totally fine, normal birth. She was totally fine until 3 months of age. The first seizure occurrence was at the age of 3 months. That too, it was not very apparent. So she was at my place. Both her mom and my mom, they could not recognize that it is some kind of weird thing. They were just correlating that to a startling behavior.
Right.
So she was constantly crying, and then when I went home from Bangalore, then I noticed that she was doing that in clusters. That 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 behavior itself was little bit weird for me,
Alarming, yes.
alarming to me.
Yes.
Then I asked we consulted 3 local pediatricians. All of them concluded as startling behavior. I was not satisfied. So I immediately asked the reference of pediatric neurologist.
So they didn't take it very seriously.
No,
They
not
just
at all.
thought that it
That's
was
a starting
just
behavior.
Okay.
I consulted a pediatrician in Bangalore also,
Ah.
in a famous Cloud9, in the hospitals. They also took it as startling behavior.
Okay.
Then I requested them to give a pediatric neurologist on my own,
Right.
and then I went to a pediatric neurologist. I showed the video. Immediately they diagnosed with West syndrome. It was immediate. Not even a EEG was done.
Yeah.
By showing the video and by seeing her, they diagnosed as West syndrome. And then EEG was done, MRI was done. EEG was abnormal. This found a modified hips arrhythmia, which confirmed, West syndrome behavior. MRI was normal. And later we started off with lot of epilepsy drugs, starting with steroids. And the first course of steroids, it was fine. Then later it recurred, and there is no respite after that.
Okay. So did it? So how long was the relief for when you took the steroids? Was it 1.5?
1.5 month.
1.5 months.
Yeah.
And then did it decrease after that, or was it more in
Uh,
numbers?
so basically, in 1.5 month, it was totally fine. When it recurred, when the recurrence happened, it was much more stronger in terms of intensity and frequency.
So another thing that they really practice is these ACTH injections with West syndrome cases. Did that help?
That did aggravate for us.
It made it worse.
Yes, it made it a lot more worse.
Okay. So
The day of injection, basically we have started the daily course of injection.
Right.
And the day of injection, she was totally abnormal. It got aggravated.
Right.
And then when they stopped injection, because during the tapering down protocol, they give alternate days. Right. On the day of when there is no injection that has to be given for the kid, she was totally fine.
Okay, she was totally fine.
Yeah.
So under your observation, it made it worse rather than kind of made it better.
Yes.
Yeah. Then when you got, I think you got saved by one of the doctors who got a blood test done for B12. Yes. And D3.
Yeah. This is again, when we went for this, when it recurred, we went for the second dose of steroids, but
Right.
it did not work on her. The second dose did not act on her.
Right.
It made it worse. It made it worse in the sense she became inactive. She became very sluggish, and she became totally inactive, and no play, no smile, no social smile, nothing. She has lost everything.
So it came down to more like global development delay.
Kind of thing. Yeah.
Okay.
Then after that, we've stopped all the steroids, and then we moved to native, a place. And then we went to a local pediatrician asking him like, whether we could give IV fluids, just that she could gain some energy.
Right.
Incidentally, I don't know whether it's some kind of coincidence. He asked,
Okay.
did you do any blood checkup or blood routine checkup,
Right.
or B12 to be
Right.
specific? I
Right.
said no. Then he asked us to get it done. It was very low, and then MMA was
Really?
extremely high.
Right.
With one dose of B12, she became totally active.
She became
One
totally
dose,
active.
just one injection.
Okay.
She gained her smile. She gained her, basically, because for us, we were praying that at least we were hoping and wishing that at least we could see her smile.
Right.
That was
Of
totally,
course.
we were in, I don't know. She can better explain the situation how she was. She was totally dejected. I mean, I don't know whether we could at least see her smile again.
Right.
And he was a savior. He was God for us.
Yeah. No, of course, see, diagnosis is a very important part of when you're treating a child. And I think allopathy with the Western medicines, when we talk about it, diagnosis is done through most of the doctors now. Instead of assessing it properly, they go straight into the symptoms and then they say it is CP or it is autism. Or sometimes they mix it. With her, I saw her kind of report, and it is straight away written, categorizing things with the, labels. Now, it could have been very simple if they would have tested her straight away if there is any blood test that they need to do. It's very, very important to get your child to have a blood test before you start any of these medications. Try and get the basic at least blood tests done where like they did B12, D3, calcium, sugar, sodium, creatine. All of these things are very important to understand, and also get the liver and kidney test done, because those are the things that will tell you what is actually happening in the body, which is bringing seizures. Now, you came yesterday and you did the treatment. We've done one treatment on her. What are the changes that you have seen within that one treatment and today?
So basically, her response has improved. I mean, there's no doubt about it.
Right.
Because when we came in, she was randomly she was talking, uttering certain words, and now basically her responsiveness, her alertness has improved for sure.
So when she was screaming before, like just now, I don't think she would have said like this before. That the first day that she came, she was almost screaming and crying and getting irritated. Yeah. So I no wonder they said it is autism straight away, because once what happens, this is all related to the imbalance in the body. So when we treated that area, that's what I said, I will only go for the neurological disorders, and that's what we will work with, because all of these symptoms that came through, it is not really related to the labels that are put on her, which is, I don't think she has global development delay, because there is physically she's not doing that bad. Yes, there is some form of imbalance and coordination issues and all that, but I think the report that was there at that time, I think it has come better. So you guys are doing well. So we would say that irritability, sensory
Hyperactivity has come down.
hyperactivity,
Yeah, definitely it has come down. Because,
it has come down.
yeah. And basically, she wouldn't sleep when when the lights were on, when generally when there's
We have
noise,
to keep the room quiet,
lights turned off,
and some kind of white noise has to be there.
not for it. But I think she has slept now, I think, without any of that.
She was sleeping without having the
Light,
moment she was sleeping with the lights on and everything.
Yeah, had we not, should have comfortably slept. But that is a biggest thing for us.
And
If we
also
continues,
her, what about her response, like command following? Has that improved from yesterday to today?
basically, how would I say, when I went there and they came back, she called me Nana.
Straight away.
She
She
saw
saw me and then
and
called me
immediately
Nana.
said,
Okay.
Generally,
there is still a competition going on when she's going to call you mama, amma.
Yeah, but she'll call me when I'm not around.
Oh, she'll call you when you're not around. So you'll have to hide sometimes and not be there.
Basically, she was there with playing with her, my mother-in-law. Then I went there and I was talking to my mother and came back. She called me and looked at me and called me Nana. That's
so which is different.
Yeah.
Okay. And what about her, like walking on the toes that you written down over here, and also for involuntary movements that we spoke about? Because there are about 13 things that you've told. We haven't really had a descriptive information yet, but how is her involuntary movement that we were talking about?
We didn't see any involuntary movements as such now.
As such,
anything
okay.
as of now we didn't see.
Okay.
We'll let you know if there is anything for sure.
So that has been improved.
As of now, there is no.
Okay. And what about the body balance? So
after you telling us, we have noticed.
We have noticed.
We have noticed before. It's just like everything is the same for us. After you telling the specifics of it, right? Like how she was, moving about. And then we have noticed we have definitely.
So now she's stable.
Yeah.
And did she climb the stairs before?
Yes, she was climbing and then she stopped. And now she is able to.
She's doing again. She's climbing again. So
basically, generally we used to hold her. We don't leave her without support for sure, because we were you, as you told us, because we are always
because of the imbalance. Obviously, you would not want to leave. So, but this time she climbed by herself the stairs in the morning.
Yeah, she did climb.
Yeah. Okay. So overall, how do you feel about having that treatment done, and what is the overall idea that you got?
My mom told she's finding it to be positive.
Yeah.
That from yesterday to today, she's finding it positive. And overall our feelings are the same. We are finding it very positive, and we are hoping that
so there are a lot of people who are very skeptical about going for natural treatments, because see, once the Western medications or general medical system, if they say that, oh, this is the best that we can do is give medications and there's nothing else that can be done for the child, what are your views? Because you are a new generation, you are the new, educated parents who have done, and you've been everywhere and you live in Bangalore as well, so you must have gone through all of those systems. What is the advice that you want to give to other parents from your experience? Because a lot of youth nowadays, the first time parents, are going through probably the same thing as what you guys are. So what is the message that you want to give?
Honestly speaking, we have used somewhere about 20 AEDs on her.
20
anti-epileptic drugs on her.
Oh gosh, okay.
I think more or less close to 20.
Okay.
Out of which I told you, first dose of steroids worked, and again it recurred.
Right.
And other drugs that worked was 5 count to 2.
Right.
So we have also tried Naadi Yoga at the age of 6 months, 9 months, 9 months. But since COVID time, we could not continue. And we were always having in the back of our mind, why we have to go. And somehow it worked out for us. I'm happy for that. It worked out for us.
Right.
I'm not telling that you have to go. At least you have to try out these things which are non-invasive, which are which doesn't cause any damage to the body.
Right.
If it improves, it only improves.
Yes.
You have to try. Only the last resort you have to go for.
See, I always say, that's what I say to parents. Let the medication go on, like what I told you as well. Don't stop the medication.
But this will not cause any damage or any to the body. It only helps and improves.
So have you seen any treatment like what I do now on your child? Have you ever seen anything like that before?
No, we haven't.
And have you ever seen such improvement in the child in such a short period of time?
Nothing, ma'am.
No,
I told you, right? Only first dose of steroids. After that recurred, there is no stoppage after that.
So would you say that natural treatment can also bring a lot of changes faster?
Yes, we have.
Right?
Yeah, we have seen, right?
Because a lot of, like I said, people have these perceptions, right, about natural treatment is that they take very long, and it brings results, but it takes very long, and it is very tedious, and all of these things.
How do I say? I think
I mean,
you'll
it
have
is
to make effort for sure. Unless we make effort, we cannot bring about change in the kid. We have to strive towards that thing. See,
Okay.
if we be silent, if you give just a Medicaid pill, it will not work out for sure. Even during that, a lot of side. See, the terrible thing that we have experienced so far using allopathic medicine is side effects. With
yeah.
terrible side
Yes.
effects, and which from which we tell the doctor these are the side effects. Then these are expected. And what do we do about it? You have to live with it.
Yeah, that's not something every parent
So,
can
ma'am,
do.
We have thought for
one
almost a month to give any allopathy medicine because we were so scared of the side effects.
Yes.
I mean, thought about 1 month we have to start. Do we have to start? Do we have to start? And we have to face all this. Should we make her to undergo all
every
this trouble
medication that
again?
we start, we'll have to think at least one for about month. When the situation get worsen, we say okay. Anyway, we'll start.
Yeah, because you didn't know that there was any other option which is
Option.
Yeah,
available.
yeah,
I
yeah.
mean, natural therapy, though it takes time, effort, but
It'll be long
it will
lasting, I
give,
guess.
yeah, long lasting and good result. Allopathy, it will be easier to like proceed.
Give, just yeah.
Yeah, but you don't know what are the effects that
I'll not
how I
say
mean,
I'll not say a natural alternative medicine, natural therapy is not. It's less tedious or less. You'll have to work for it. I mean, there's a cause. Your kid is having some issue. Only if you strive towards it, we can achieve certain things, and
Right.
you'll be happy after that. Unless you put effort, results will not come for sure.
That's a very good point that, I think when you hear young couples who are sitting here, you have to understand that if you don't put effort, and that is on point. If you don't put effort, you can't get results. And this is your child. This is something that you have to think that don't think that I always say to the parents, don't think until you are young. Think about when you get old. Because when I get a child who's like 100 kgs, and the parent is in their 50s and 40s or 50s, it's very disappointing to see that, because they could have done something if they knew that they could go through the alternative healing techniques as well, like Naadi Yoga. So there are a lot of people who are working on this, and Nadi Yoga, I've got like 15 years of experience working with children like that. And I'm telling you that this is not something that you need to worry about.
One more thing, every kid is different.
Yes.
Some kid will respond in a day or two. Some kid will take at least 3 to 4 months, and it'll take its own time for sure. We'll have to be patient
You have to be
realistic and patient
and
also,
practical.
and practical.
Because
That's
see
one
what
more.
happens is, like with her case now, a diagnosis have been wrong for her. A lot of diagnoses, like a lot of labels have been put on her, and I don't think that those labels suits her, right? Maybe in time, when that report was made, maybe in time her neuroplasticity has been working better. But like I said, that the more treatment you will give her, the diet that you will give her, her immune system will get better, because with her it's more to do with her immunity, right? So it is very, that's what I said, diagnosis is very
I
important.
just want to add one more point, ma'am. During vaccination, we will have to be extremely careful because she was diagnosed with ear infection the day after vaccination. I mean that could also cause these issues. What we were told. So vaccinations during at the time of when the body immunity is already low, giving live virus as a vaccination is more dangerous than anything else.
I always say that to the parent, that you don't have to give each and every vaccination to the child. Study about vaccination, see whether your child needs that vaccination. But before you start on that, make sure that her immunity is strong. She's not having any infection. So again, blood test. Even if the baby is very young, make sure you get that blood test and see whether there is sugar issues or salts, like I said, all of those things. And with her, it was B12, right, and folic acid. So all of these things needs to be checked, and then give the immunity. So then give vaccination. Don't just give vaccination just because they're born and they're supposed to get, or maybe they have slight jaundice. All of these reasons, we just start giving the BCG vaccination and all that, which is great. BCG is great, polio is great because it's coming from generation to generation. That's not an issue. But I would still request all the parents to please get the blood test, check what level of blood works are happening, and then give the vaccination if you feel safe. Because as parents, you have to understand the importance of vaccination. It is not as safe as what people make out to be, especially when the immunity is down. So there are a lot of people who would be watching this video. What do you have to say about your experience at Naadi Yoga?
They're totally positive about it. I mean, you have an alternative, and it'll work out for sure if you trust. You'll have to trust and come, and you have to be positive towards it. Only if you are positive towards it, anything can be, even if ma'am does the therapy, if you're not positive, I don't feel you'll get 100% result for sure.
I agree with that. Faith and positivity is a very vital part. But I want to mention something which is very beautiful over here is the Dadi and Nani. Both are here supporting them, and you can see how child is so comfortable with both of them, and it's so vital to have a family support. It's incredible, and I think you guys are very lucky to have that support.
Definitely, for sure. I mean,
Right? And
it will
you
not be
have
possible.
a friend as well that
Yes.
has come with his
Yes.
mom as
Yes.
well, right? So I think they came. I think they came down here to see Uttarakhand. To be very honest, I'm not.
No, I
This is the
mean,
first reason.
so
That is the side
Primary.
part.
so even my friend, right? Even
Yeah.
if they were not coming, he was supposed to come for sure. Only
Ah.
initially three were planned to come. Then all the mothers accompanied.
No, there is definitely some magic about Uttarakhand, and it is known as a land of gods.
Devbhoomi,
So,
right?
Yes.
Devbhoomi. So I hope that when you're going back, and then when you're contacting me again in these 3 months, we're going to see a very positive change.
We will see, ma'am. We will see.
Yes, but like I said, I do 20%, you do
80% of it.
80%. So once we get that equation sorted, we're done. So whenever you're looking at the child, whenever you are in your heart, in your intuitions, you know there's something wrong. Make sure you get it completely thorough, because a parent's intuition is better than a doctor's intuition. Thank you so much.
Thank you.
Thank you.